Colleagues, thank you for interrupting your day this late Thursday afternoon so that we could have a time to talk about some news that I learned this morning during the Chancellor's call that I felt was important enough to convey to you. I also want to share those facts with you, but be able to clarify some questions about our dashboard and also about who is making decisions about campuses being online or not. I want to begin by commending our campus, our students, our faculty, and our staff. We are not in a position where we will need to move to online education, although I understand there's been some rumor about that on campus. But I did want to share with you that you know of the decision at UNC Chapel Hill, and the news today, frankly, is that NC State will move for undergraduate instruction in an online modality only. So let's get to some of the facts as we know them. I learned this morning at 10 o'clock on the Chancellor's call. Let's first cover the Chapel Hill lessons that we heard this morning from their Chancellor. Chapel Hill remains open. All undergraduate instruction has been moved online. This is a modification of their original plan. They hoped, like we are now able to sustain, that they would have hybrid, online and in-person classes. And that clearly needed to be modified after only 6 days following their opening. At Chapel Hill, all graduate and professional school education, including all research and technical labs, will continue as in-person or hybrid or online, and all of the libraries and research labs at Chapel Hill remain open. What happened at Chapel Hill is the following. Over the first weekend before their first day of class, and remember they started on the 10th just like we did, well, there were very few parties or gatherings that would challenge or violate the governor's orders. There were quite a few events off campus in both student apartments where upper class students were living and in some fraternity and sorority houses. Most of those events involved over 100 students at each one, some as high as 300. And students who were at those events generally were not wearing masks. It became clear midweek last week that they had an increasing positivity rate of those tested and a scaled up need for contact tracing. Last weekend, as they approached the weekend, the situation was clear in that they were beginning to exceed their capacity in both quarantine and isolation on campus, and that the county health department was alerting them that more students and others were reporting infection rates. They made a decision at that point to move all undergraduate education online and to de-densify their residence halls. That decision, as has been true since March, was a decision about campus operations that was made by the president of the system, President Peter Hans, and by Chancellor Guskowitz in consultation with the Board of Governors. They are de-densifying their student residence halls from around 5,700 beds to closer to 2,500. Any student undergraduates who are currently in quarantine or awaiting test results will be staying in quarantine or isolation until they are well enough to return to their homes. What we learned today is that NC State has experienced the same kind of very unfortunate, mostly off-campus events that were hosted by students. They were not university sanctioned activities. And now they too are experiencing a large uptick in the number of students who have symptoms, who have been tested and found positive, and scaled up greatly their number of contact tracing needs to amounts that almost exceed what even their health department will be doing. There have been no outbreaks in their own residence halls until after these off-campus situations. So I'd like to read you directly from the news story that has just been released, NC State Chancellor Woodson's statement that may help to frame the facts as we know them. And I quote, "This week we've seen a rapidly increasing trend in COVID-19 infections in the NC State community, including the clusters mentioned above, and there are several that relate to parties related to Greek House and Greek Village houses. As of today, through our aggressive contact tracing program, we have more than 500 students in quarantine and isolation, mostly off campus, who have either tested positive or who have been in contact with someone who has tested positive. We are also investigating other potential off-campus clusters. To protect the health and safety of the entire campus community, we are making difficult decisions and implementing the following changes to campus operations. Undergraduate courses will be moving to online only beginning August 24th. Residential housing, campus facilities and services will remain open, but for limited residential student use. They also are de-densifying their residence halls. So with that news, we also learned from President Peter Hans this statement. So I'm reading you something that was released just within an hour or so from UNC System President Hans. And I quote, "Over the spring and summer, every institution prepared for the fall semester under the guidance of well-known public health officials. That planning reflected the fact that each university in the system is different, with diverse student populations, geographical locations, and varied social cultures. This work is being undermined by a very small number of students behaving irresponsibly off campus, which unfairly punishes the vast majority of their classmates who are following the rules." Again, Peter Hans, and I'm quoting, "Since my arrival on August 1, I've worked closely with each chancellor to support their efforts to make adjustments based on local health conditions. We continue to provide high quality mix of online and in-person educational options where it is possible to do that, as the entire nation strives to maintain and manage its way through the lengthy global pandemic to a better and safer place for everyone." So there are a couple of takeaways. In contrast to Chapel Hill and NC State, our community, in fact, has done very well during our nearly 2 weeks as open for online, hybrid, and in-person instruction. Heather, I'd like to call on you to give us at this point some of our dashboard information, and then we'll talk further about the dashboard.
Yep, and this is public information that's on our website. We sent the link to you all last Monday, I believe. And we are updating the website every day. Thank you, Sarah, for putting it in the chat. And so last week, during our first week of classes, we had 3 reported positive cases. That brought us to a total of 10 positives since July 1, 2020. We're using that number because that's what the system is using across all of the institutions for tracking for cumulative cases. So far this week, we have had 0 new cases reported. We have 92 beds for isolation and quarantine on campus, and we're using 7% of that so far. So our utilization rates are much lower than other schools, certainly Chapel Hill and NC State. And our numbers are, I'm not going to do math because I told the chancellor I'm an English major with a law degree, but obviously 3 cases for our first 2 weeks is a much lower percentage than what other schools, but specifically what Chapel Hill and NC State we're seeing.
Thank you. And I understand from some of you that there's been confusion about the daily, what now will become a daily dashboard. We want you to know these numbers, good or bad. We want you to see exactly where we are with this. Fortunately, our numbers are among the lowest across all 17 institutions because you all are doing more than your fair share to keep yourselves and your students protected and well and healthy. Whether it's some of our faculty and staff who are staying away from campus or teleworking for any number of reasons, or whether it's our faculty and staff who are located on campus every day, doing the work we're doing, but doing it safely. Now, that said, we will update our daily dashboard on the website every day except for Monday. And the reason we need Monday as a day when we can gather the reports over the weekend, we can't be sure until we can gather the points of information from residents' life, from the health center, from our counseling center, and so on, to understand really where we are and be able to check with the county health department in case they have heard of cases that tested positive in our community that we were not aware of. So we will be putting a daily dashboard up. Heather, is there a time of day that folks could count on this, or what would you guess?
So I think we can also have updates on Mondays. Mondays will just be a little bit later because we are gathering things over the weekend. We've been updating prior to noon so far, now that we finally are in a rhythm and are understanding what we're reporting to the system and getting our data updated. So it's by noon every day.
Thank you. On a second note, I've understood that there may be skepticism or doubt or critique about whether or not your chancellor has the power to make a decision to move our instructional modalities to an online platform only. There's question or doubt that perhaps Kai has that and I don't. There's been some accusation that we have this power and we're simply not using it. Let me clarify again. Since March, when it was the decision of the UNC system leadership together with the Board of Governors to move us to online, given the COVID descending upon our lives, all the way along, even the approval of our plans that were developed in May and June, all of the power rests here with the UNC system president. It was Dr. Roper, now it is Mr. Hans. Both Dr. Roper and Mr. Hans have been working very closely with the Board of Governors itself, keeping them apprised of various different situations. And when the decision was made by President Hans and Chancellor Guskowitz, and now this morning by President Hans and Chancellor Woodson at NC State, in both cases, the Chancellor and the President consulted directly with the Board of Governors. So I do want to make it clear that we are following the instructions that we are being asked and required to follow. And the monitoring of our health data will be a part of a weekly call for every chancellor with President Hans, so that if there is some uncertainty or if we see an increase in the positivity rate, a pushing of the boundaries of our own capacity in quarantine or isolation, then we will engage in those conversations if they are necessary. In the meantime, what I'm proud of is that our numbers are so low. There are a couple of distinguishing things we've been doing that are different from NC State and Chapel Hill, and this is not meant to brag on our side or to criticize either of those great institutions. Our 45 student health ambassadors appear, we don't have any data yet, but appear to be making a real impact on student compliance, particularly with mask wearing and social distancing, not just in our classrooms and our hallways and Highsmith and our dining hall, but in the off hours of the evenings, the weekends. They've already made a big difference in the behavior of our students. Secondly, our student athletes, there are 266 of them who've come to campus either as first years or continuing students. Those students are being tested repeatedly. They are being monitored. They're daily symptom checking very carefully, just as all of us are expected to do every single morning. And we believe that that kind of discipline also is helping with our abiding the best-in-class health protocols that we've tried very hard with lots of work by many people to put in place. The third is that all of our protocols were emanated from conversations with physicians at Mission, and particularly with Dr. Amy Lanou and her colleagues at Mayhew. And so from the very beginning, we were very careful about all of the directions that we were getting. And finally, we have a very good, open, and robust relationship with the Department of Health here in Buncombe County. It's very easy to call Stacy Sanders, who is the director. She and Heather have been working together. I know Jay Kutzbeck and David Weldon and Bill Haggard all have been in touch with the leaders in the healthcare community in Asheville. We benefit greatly from the fact that we continue to bend the curve downward. That is not necessarily true in some of the other counties. So when, as Peter Hahn said this morning, we are located in specifically different regions that are also highly culturally varied across the 17 institutions. And so just because our flagship institutions have made modifications to their plans does not mean that we have to or even should do that. And so I wanted to speak directly with these opening comments and just again end with my repeated but heartfelt thanks to everybody that's so far, almost 2 weeks together gathered as an academic community. It appears that we are staving off the virus, and where it exists in our midst, we're catching it early enough that people are protected and allowed to remain healthy in our midst. So let me stop there and see, particularly Heather, if you would like to add anything, and then also if Bill Haggard would like to add anything.
Thank you, Chancellor. There's been a couple of questions in the chat about adding our positivity rate. So the number of tests that we're administering, and then what our positivity rate is. We do plan on adding that. The data that we're putting on our dashboard is something that we're also coordinating with the UNC system. And there was conversation as recently as yesterday with the folks putting that together about how we're tracking that. And so we just want to make sure we have our process correct before we begin to publish anything. So we do plan on that. We just have to make sure we're correct.
Heather, let me offer a frame there, because just like learning about plexiglass, anything about before these last 4 months, let me give us all a frame to understand this. Keeping a positivity rate under 5% is seen as the Department of Health and Human Services as a reasonable positivity rate. Anything that exceeds 5% is something that requires additional action, additional intervention of some kind. And when Chapel Hill made the decision to take undergraduate pedagogy all online, they were at nearly 14% positivity rate. I did not hear any mention of a number this morning, but that was one of the metrics that factored into the decision by Chancellor Woodson and President Hans. So that gives us a way to understand it. We want to stay under 5% and as low as possible, but the danger zone is anything that gets above 10%. Let's review other questions in the chat. And Bill, do you have anything else to add?
Thank you, Chancellor. Good afternoon, everyone. I would just like to add my thanks and commendations to all the great work that people are doing that really have us right now in a real best case scenario, you know, so far this semester and so far today, but really the work that people have done has really made a difference. And also to commend our students, our student leaders who have really taken a real important role in setting the culture of compliance and care that has been successful so far. We are fortunate. Each campus is different and has obviously its location specific and unique in its own culture. And our culture is such that we don't, under normal circumstances, have some of the same off-campus large party environment as some of the other communities have. But we're not just resting with that notion. We are taking action. Janet Cohen and I have come together, and we're having conversations with certain property ownership and apartment management of those apartment complexes that predominantly house our off-campus students here in Asheville. We're having good, productive conversations with those folks, and so far they're very, very cooperative in trying to set the right standards for safety in their environments as well. We've had a long-term good relationship with the Asheville Police Department, and in the rare event that we have a large house party or something, they will always contact our campus police and usually assist in identifying folks there. And we have renewed that communication with our local law enforcement as well. And then also just working with our even though we only have 4 Greek letter organizations, traditional fraternities and sororities, we've already have been working with the leadership, the cooperation with the leadership of those groups to do all we can to make sure that there's a good, responsible off-campus social environment. So while we haven't had an incident yet of any large off-campus party, that doesn't mean we're resting on those laurels. We're still taking action, having conversations, communicating with folks to make sure we're doing all we can so our students understand that that the off-campus behaviors can have an impact on what we can do as a university. But again, thank you for what everybody is doing that has us in this current really good situation for us right now, we believe, compared to our colleagues in the rest of the system. Thank you, Chancellor.
Thank you, Bill. Sarah, there are a number of questions in the chat. Let's move to that. Maybe you'll read these out and then any one of us can attempt an answer to those.
Yes, thank you for your questions in the chat. We'll just take them in the order that they came, first come, first serve. There is a question here that I know has been addressed in the town halls previously. What numbers would constitute an outbreak at UNC Asheville worthy enough to require a shift to online instruction?
Well, there's no clear number that would cause us to say we've got to move. It would be an amalgam of indications that a pivot would be necessary. Positivity rate is one. Another is our capacity for quarantine and isolation spaces is being exceeded. The third is if we see students and others not following the protocols that are both mandated by the governor and the Department of Health and Human Services, but would be violating our own county rules about failing to understand mask, distancing, et cetera, et cetera. So I think it would be the indications that there was spread occurring and that through the contact tracing, there were too many students who were being exposed. If those kinds of numbers came together in a unified way, then we would be in a position where we would raise the questions to the president of the system about what their recommendation would be. This is exactly what happened at Chapel Hill and at NC State.
Thank you, Chancellor. Another question here, talking about the fact, we're talking about tests now. Is there available information about how many tests have been administered on campus, the rate of positivity? And then could you also clarify for those who are not plugged into athletics, sort of why the student athletes are getting tested more often and the process there?
Heather, do you want to answer this? I don't have a total number of tests because our staff and faculty would be working with private health providers. It's our students who might be using the student center, health center, or the range. So Heather, what do you know about that?
So I mentioned earlier that we do plan on publishing our positivity data as soon as we know, as soon as we've tested it and we understand we're doing it correctly. We don't test our faculty and staff. Very few of our UNC system campuses do. And so that is why we have the form that we sent out to campus that's available at the bottom of the link that Sarah put in the chat initially for self-reporting. And so we encourage and ask all of you to please do self-report. If you can report if you've tested positive, if you are taking a test and it's pending, you can also report concerns. And so please do use that form. It is secure. You have to, go through the link and it comes straight to HR. And so it's confidential. If you have students that you want to report their identity, you can use that form as well. And we're making sure that health and counseling gets those immediately. So we do encourage you to do that. And in terms of athletics, I don't know if Janet is on here. If you are, chime in. So the reason that we're surveillance testing athletes, and that's what that's called, is surveillance testing. That's an NCAA standard, and we decided to follow that. The question is also, why wouldn't we test those in dorms? We're looking at surveillance testing other populations that might be more dense or more at risk.
I want to speak directly to, thank you, Ashley Moragas and Ann Jansen and Judy, for questions about the dashboard and reporting. And your reflection here that you second Ashley's questions, but you say, I've had a few students this week tell me they're getting tested. I hope anybody who is going through testing is self-quarantining or is quarantining within the provided areas on campus. So anyone who's telling you that and standing in front of your classroom telling you that is probably not doing the best thing. So anyone who has symptoms and is getting tested should wait until the test is back, or if you've been contact traced and contacted in that sense, I would think that you would want to quarantine just out of consideration for every single one of your colleagues as students, faculty, and staff.
And Chancellor, can I just add to that point, and then add on? There's a question about accommodating students there. As Heather just noted, the form that we have and that where the link is in the chat, it does allow for you to let us know about someone else. So it is about self-reporting, but it is also a way to report indication that you have been notified that, let's say, a student has indicated that they are testing, they feel symptomatic, or whatever the case may be. If you use that form to let us know, we can then act on that information and be able to know how we might need to follow up. So I would certainly encourage you to let us know about folks in the community that are letting you know that they have either symptoms or they are isolating, or there's some kind of concern. In my view, the more information we can have about those kinds of things, the better off we are. I think Peter has asked the question about as students identify themselves as someone who's quarantining and isolating, and what can they do? I would ask that you work with Lindy Hewitt and the CTL, and certainly if you report to your chair or to the dean, we will try to do everything we can to help facilitate the technology needs or whatever strategies are possible to help you be able to accommodate those students who may be in that kind of situation. So please look to the CTL and either to the chair or to the deans to kind of help navigate that space.
Thanks, Provost Campbell. Sarah, let's go to London's question.
Absolutely. London actually had a couple of questions. So the first one she asked is sort of what, I'm sorry, there were a lot and I'm trying to suss it out here. She's asking how are we preparing to take care of the campus community in case we do move to all remote courses? So
I'm going to start on this one, and I'd like to make sure that both Bill and Provost Campbell have a way to answer to this as well. From the time that we were asked to create various scenario plans regarding how we would return to in-person instruction after the online-only summer, we have been working on different scenarios, including the very one that Chapel Hill and NC State, in their modifications of their plans, have now moved to. So we have, as a senior staff, and sometimes also briefing faculty, senate, executive, and talking with generally some students, we have been trying to think about what we would do since actually late April. And in our plans, we have a system whereby we would be allowed to take care, we certainly would be required to take care of our campus in case we move to online. Fortunately, and there's a pro to this and a con, our 1,550 beds or locations where students can be in our residence halls now only have 1,280 students in our residence halls. It may be actually a little bit smaller than that number, Bill, if you correct that when you can. But London, you should know that we are prepared to work with students to provide continuity of their educational process, even if everything were to return to online, and to allow as many as possible of our students who wanted to stay in the residence halls to be able to stay, and again, to have the continuity of employment for as many of our employees as we could in that situation. So Bill, would you speak first, and then I'll call on Provost Campbell.
Sure. Thank you, Chancellor. First, we currently have 1,296 students in our residence halls. Chancellor, that 1,280 number is, you did hear that from me. We're using that as a conservative number for budgeting purposes. That's where that 1,280 figure came from. We're currently at 1,296. So we're working very hard not to get to the point where we would have to go to remote instruction. But if we do, we have experience from mid-March of the process of helping students move out of the residence halls if that is the best thing. So we've learned from that. I thought we did a very good job in March, but we would do a better job if we have to do that again because we've had the experience to learn from. The other important piece to this, in both the Chapel Hill case or situation and today in the NC State situation, both of those campuses in their decision-making with the system leadership have said that, that students will have the opportunity to remain on campus. That's extremely important when it comes to our care of students, because they're obviously on both of those campuses, they'll be reducing the capacity in their halls, as the Chancellor said. But for many students, this is the best and safest environment for them to live right now. And so when we made the shift in March, we actually started with about 194, I think it was, 164, excuse me, exceptions that we granted. And some of those students throughout the rest of the semester then elected themselves to move off campus. But we still had about 64 or so at the end of the spring semester for whom this was their safest and best place to live. And we continued our dining services on a safe pickup, takeout type of situation. So it's our intent, and it has been the model so far with what has happened with Chapel Hill and NC State, that students, if this was the best and safest place for them, that they would have the opportunity to stay, and we would continue to serve those students on our campus. Our health and counseling folks have been extremely busy, especially our counselors, and this has been a time of increased anxiety. So those folks are working really hard over this summer, both the remainder of the spring semester and over the summer. Their caseload remained pretty full, so we would be still supporting students in that regard as well. So we've had some experience from the spring that will help guide us into best practice as we care for our students in the event we would have to do that this fall.
Thank you very much. Provost Campbell, what about support for faculty and care for our faculty and staff if we move back to online only?
Yeah, so I'll start with the students. I mean, to Bill's point, we anticipate having students be able to still utilize some of the campus, and so that, for example, if there's a need for internet access, if there's a need for certain technology access, which I think from our lessons learned from the spring was that those two things tended to be important factors. And so I think making sure that we have some availability for those students who remain and who need to remain on campus and have access. So certainly that's something that we can do. You know, I think we'll be in a position of shifting in much the same ways that we did last spring, but hopefully with a bit more, given that most classes are either online or hybrid, and some combination of those two make up the predominant portion of classes. We hope that the transition is a lot smoother, and certainly recognizing that for those of you who did do the work of engaging in both hybrid and in-person courses, there is still work to be done, and I certainly want to acknowledge that. We'll have to work to use all the lessons we've learned to help folks transition. The good thing is that we do have the technology better set up, better ready, better in place, the support infrastructure, and again, all of the lessons learned that we can have coming out of the CTL, other faculty. So there's a lot that I think we can share to get us there, get us to a good spot more quickly. And again, there's still going to be work to be done, but I think we'll be in a better spot than we were last spring.
Thank you. I want to respond to a couple things. London, you're saying if we approach 5%, will you start conversations? It would probably mean that we would exceed the 5% and go into health department defined ranges where alternative modifications would be considered. But you're right, we're already thinking about this. Should we reach that point where it appears to be the most important thing to do to keep our community safe? I also want to second Jill Moffitt's comment about how hard folks have been working to reinforce standards of protocols and safety practices. We just simply can't thank that group of folks who have been a part of weaving the community into understanding how essential and important this work is. I also want to clarify somewhat for you, Steve, and I see that Connor Green has also mentioned this. I know what I read was critical of the students, but I must remind you that, and I have no reason to defend my colleagues at Chapel Hill except to clarify the assumptions here. Parties off campus were prohibited in all of the planning at Chapel Hill and at NC State. Students who had the parties were violating governor's rules, and they were violating the law in how they were gathering people together. They had been prior, these student leaders in these various different groups, and I don't know all of the groups, had been actually asked by UNC leadership not to do what they actually did. And so in a way, and again, I don't understand all the motivations or any of the facts really, the students who, and literally hundreds of students were involved in this, were literally breaking the law. And we're not following what the Chapel Hill leaders, faculty, staff, and students and their planning committees had made very clear to some of the organizations that are contiguous to campus where these large parties took place. So I understand there's critique of students going on, but some of that may in fact be relevant as a lesson, because the things that happen off campus quickly can infect a campus of that large a scale, and that's what happened. Sarah, let's go on to some other questions.
Thank you, Chancellor. So there's a question, curious what would happen if staff were to have to move to online only, given that classes would still be taught online, assuming it were too late to drop or withdrawal. This is from Jeremiah. Jeremiah, I think, are you talking about staff in the academic area? Maybe a clarification there would be useful. We also have a question about whether or not students are getting these updates from other universities.
I don't know that, but our intention is to continue to communicate with students and with faculty and staff so that we all have as much as we can the facts of the situation and where we stand relative to these dilemmas and uncertainties. This evening, Kai and Bill and Heather and I, together with Sarah, will be doing a video to reveal the information we learned today about NC State and to remind students that we have a way to avoid having to move to online or reduce the activities of the campus. And so we'll probably have a town hall. I know London Newton is leading one next Tuesday. I'll be joining that at her invitation, as will Provost Campbell. So that'll be another time, at least with student government, we can get the word out. Sarah?
A question came in, since testing is limited in terms of campus, will the positivity rate in the surrounding regions factor into any decision to go remote?
It is clearly a part of what we are following, in addition to things that we wouldn't necessarily be putting in the dashboard, but we're following daily. That is hospitalizations, ICU bed capacity, positivity rates in the other higher education institutions. Because the K through 12 in both county and city are online only at this point, we wouldn't get testing results on that. But if they should reconvene for in-person instruction, we'd be watching that. So that's where our partner in the health department, Dr. Stacy Sanders, and her whole team has been closely involved with us basically since April on these issues.
Sorry, there's a question here. What actions are being taken with students who test positive who may not be isolating? How do we know they're compliant?
Bill, I'm going to throw that one to you if you would, please.
Thank you for that question. Yeah, that would, that's a serious student conduct issue. So we would have a student conduct intervention with any student who is refusing to quarantine or more importantly, refusing to isolate. We haven't had that situation yet. We've been able to work through the cases, the small number of cases we've had with students. But we would consider that we have in our code of community standards, basically our student conduct code, we have one of our prohibited conducts is any conduct that threatens the health or safety of any person. And obviously this would qualify for that. So there would be a student conduct intervention there. I'd rather not name a prescribed sanction because it would depend on the facts of the case, exactly how we responded to that student. But hopefully through all the work with our students and the great work the staff is doing and talking through things with students, hopefully we will not have that type of situation. We have learned, however, I'll just add, we learn a lot since we've none of us had done this before, run a university during the pandemic, but we have learned that students aren't that crazy about quarantine. And this is something that we, didn't anticipate. And then we did learn too that some parents aren't that crazy about their students having to be in quarantine. So we've been working with these students and their parents, and so far, to the best that we can tell, it's been going very well. We have obviously much more influence when the students are quarantining on campus in our residence halls. We have a better chance of knowing exactly if they're there or not, because we have a lot of people checking up on them. We're delivering meals and those types of things, which create regular contacts for us to keep up with those folks.
Thanks, Bill. Heather, a couple other questions. Just an idea about when the test numbers might be made available on the public webpage, and then also tracking the number of new cases is really useful to understand trends, but would it be possible to include the number of active cases as well?
Yep. So with the positivity rate, the number of tests administered, the rate of positive cases, we just this week with the system are going to be doing that on a weekly basis. So our first time reporting that to the system will be this week. And David Walden, please correct me if I'm saying anything incorrect. But so it's going to be a week. So this will be our first week reporting that to the system. As long as we understand that that is correct, then we can start next week. But it is a weekly reporting versus a daily reporting. So it'll look a little bit different.
Thanks for that. So keep your eyes open on that public dashboard. And then there's also a couple questions that just popped up about, heard the suggestion that moving to online would necessitate the reduction of staff at those universities. The statement was made with the seeming implication UNC Asheville staff should be fearful about losing their job. Any clarification about this aspect or a move to remote learning would be helpful.
Let me speak to that, and then Heather, please add. At this point, we are taking a look at where our numbers stand. We've already seen, as you can tell from the numbers Bill Haggard gave you just a minute ago, we've seen some real softness in residence hall rooms. That's the positive side that gives us a little more flexibility. But there are some budget implications that we are studying right now. We'll be presenting them to the our UNCA Board of Trustees next Thursday and Friday, and should have something to report out just as soon as possible to the whole community. It is our hope to be able to have continuity of employment for all of our employees. We can do some budget cutting if we need to on operational expenses. And so we start into this hoping that we will be able to maintain the continuity for everyone. That cannot be guaranteed at this point, but we are hopeful, and that's what we are doing to approach the first level of study on this. Heather, do you want to add something?
Just to echo what the chancellor said, and to say, you know, we've said in town halls all along that, you know, our income streams are dependent on enrollment, our housing and dining numbers, and state appropriations. And we're just following that very closely.
There are no additional questions in the chat.
Well, let me conclude with a couple of thoughts. Despite the uncertainty and the worry, we really do have a job to do here. Job number one is to keep each other safe and healthy and thriving, and those in our families, and to protect and support our students to continue their educational process. You know, our academic mission means a lot, and our students have the ability to keep going as long as we can create all together, each one of us, this safe environment that so far, we don't want to get overly confident here, but so far, things are working. And Jill, I saw in there that you would like from Jordan evidence of any data. What I'm reporting is anecdotal from students saying, yeah, I've talked to my health ambassador. So at some point we will have data on whether that's as significant as we believe it might be, and an exception. But we have an important job to do. We also have the continuity of our employees to think about, and want, as I just said, for as little effect, and none if we can do it, on the continuity of any of our employees at any level in the institution. And so that's another reason to be resilient and to stay together with our in-person, hybrid, and online options for pedagogy, but also for our co-curricular and athletic and leadership activities and our diversity and equity work that is right before us that needs to be worked on by all of us, including our student leaders. And so our hope is that we will be resilient enough to see this semester through. But I hope in this conversation that you have heard about a very focused, diligent attempt to monitor all of the signs that would suggest that we should do something other than remain open for in-person instruction. Either way, we won't close. We will stay open just like we did in the spring and through the summer. And I'm hoping the in-person option continues for so many of the students who are so glad to be back and who need us to allow them to be here and to continue their work and their academic progress. We'll brief you after the Board of Trustees meeting next Thursday and Friday with any of the outcomes of that meeting, including some budget scenarios and how things look at that point. I can't thank you enough. I'm proud so far that we are doing this in as safe a way as possible. If you have any additional concerns, complaints, rumors you want to check out, or you've thought of something that we didn't see or didn't attend to as well or as thoroughly as you believe we need to. If you have those ideas, complaints, thoughts, checking out rumors, please be in direct touch with Provost Campbell, with myself, with Heather, with Bill, or with anyone in the senior staff that you feel comfortable working with and sharing your ideas and your concerns. This is a time of great uncertainty, but I do believe if we continue to be vigilant, we'll be in good shape as an institution. We'll keep our academic mission alive in its fullest form despite COVID, and that we will get through this semester. So please do the best that you can, and I'm grateful deeply to all of you every single day for the vigilance thus far. Let's not stop now. Thanks everybody for spending time this afternoon. We really appreciate it on short notice. Thanks again.